I agree about patients paying medical costs. However, how would the poor people get care? How many individuals could pay for a complicated hospitalization?
Right. Well, excellent question, but fortunately it's not hard to answer. The poor clearly need to be helped, financially helped. But how, once you've made that decision, you can provide that financial help in a lot of different ways. You can buy a comprehensive health insurance program, a la Medicaid or something like that, or you could buy a catastrophic plan and fund their HSA underneath it. There's no reason. Something that is, another thing that's being overlooked in the current discussion is a wonderful program called Cash and Counseling, which has been adopted by a whole lot of states. I forget how many, 30 or something. It allows elderly, poor people on Medicaid, so they're old, they're sick, and they're poor, to control their own resources, control a fund of resources in buying personal care services once they're disabled. It has been enormously successful. It is consumer-driven care for personal care services. And instead of being in some kind of case management program, they get to control their own funds, they get to hire their own caregivers. If they don't like the caregiver, they can fire that person, and they do it with the help of their family members, and it has been just a terrific program, and it has shown that even poor, elderly, disabled people can make their own decisions.
Is it not likely that if the health care United States plan goes through, the unfunded liabilities of Social Security, Medicaid, and Medicare will lead to rationing of health care a la Great Britain?
There is no question at all about that. And it'll be much more severe even than what Great Britain's doing today. Medicare is already $37 trillion underfunded. One of the scariest things right now is that the Obama's budget is going to add $9 trillion to the federal deficit over the next 10 years. This has been acknowledged by OMB, his own budget people. $9 trillion to the federal deficit in 10 years. That's bad enough by itself, but there's a graph that the Washington Post published that shows it. The lowest point is in 2012, after which it goes up every year into eternity. There is no way we can pay this back. I've asked my economist friends, give me a theory, give me a fantasy that shows us the way out of this. And I've yet to get an answer. There is no way of doing it. And we will not be able to find people that will buy those treasury bills to pay that. There is no answer to what we're doing right now, and all of this will simply add to the problem.
Is there any public system you're aware of in the world, or the public systems in the United States, that don't use some kind of global budgeting or some kind of rationing? I mean, there's an argument about whether this will involve rationing. I'm trying to think, are there any that don't use rationing to some degree or another? Is there rationing in Medicare and in Medicaid? Is there rationing at the VA through long lines?
Yeah, in one form or another, sure.
Right.
Yeah.
In one form or another.
Yeah.
It might be a wait for a physician, or it might be a lack of availability of physicians, or it might be paperwork or whatever. But
there's rationing in private care too. I mean, if you buy your own, you will ration your own care, but it's your choice instead of somebody else's choice.
Rationing, you mean like with a health savings account or when you buy directly?
Right. You would choose to buy one thing instead of another because you have limited funds.
Okay.
Right.
How does healthcare in Canada compare to the U.S. system as far as quality of service, ease of access, et cetera? Kind of a related question.
You got numbers on that?
Yeah. Sure. My experience, and again, this goes back quite a number of years, but my experience overall was sort of everybody got a C+ or B type of care. In the United States, you do have some disparities, but what I really cherished about the free market when I worked, for example, at Johns Hopkins was some surgeon would come along and pioneer a new surgery, and initially only certain people that sometimes were white, wealthy, and educated were the first ones to get a surgery. But today they're performing those surgeries almost drive-through. No, I'm joking about that, but sort of like gone from 14 days to 3 days, and everybody can qualify. The Canadian system is what really turned me into somebody who loves freedom more than anything. Just to make this real quick, I worked in the United States, worked at Johns Hopkins, Nancy Nurse, didn't care anything about politics, policy, moved to Canada for personal reasons, worked at a Canadian teaching hospital comparable to Johns Hopkins, and it just opened my eyes, and I decided ultimately socialism is not a policy that I want to see enacted in this country. So overall, in the Canadian system, you really lose your freedom. I watched Michael Moore's movie, and in that movie where he shows Canadians being free to go into an emergency room and seek care anytime they want, that's true. You can go in an emergency and seek care anytime you want, but there's no way, for any type of routine care, you have to go through a gatekeeper. You better love your primary care doctor and have a really good relationship with that person, and everything is more or less mother may I, mother may I, mother may I for your routine care. And I checked with a physician, Dr. Shaoli, who's still practicing in Canada, and he said it's still the policy. So I just, personally, I don't think the Canadian system will sit well with Americans in the long run, even if we try it. And I'd like to add one other thing here. I think when people are calling, I think it's important to stress that this is not a personal attack against President Obama. I've been working for freedom and not wanting socialism for many, many years, since 1996. Now that President Obama is in office, being presented as some awful person who's against a certain type of person, and that's just not true. So I think it's important for people to stress, whatever your views are, if you're somebody who's loved freedom and opposed to socialism for years and years and years, share that with your legislators. So I hope that answered the question about Canada.
In 1776, we're the colonies that rebelled against the king, and Canada's the colonies that didn't. And going back to the beginning, there's sort of a difference, isn't there? This question is about wellness and prevention. Where does such an intention, that is, government being involved with wellness and protection, lead to in a generation? What happens when ideologies of veganism, et cetera, influence the policy so that if you eat meat, you're not covered for your heart condition? It's kind of interesting. This is specifically about vegans or whatever, but increasingly I'm hearing debates on television where people say, where they want to have a soft drink tax. And Americans say it's none of your business, and then the person who wants the soda pop tax says, yes, it is, because government pays a lot of health care. Well, if government pays almost all of the health care, then it seems to me that all of a sudden government has a great deal of interest and a rationale to intrude into a whole lot of health decisions, eating decisions, taxing this, taxing that, demonizing this. Is that not true? Jump ball.
Sure. I mean, I always like to say, as soon as someone is paying your bill, it's only logical that they're going to want to know what it is they're paying for. I mean, if your employer started paying for all of your meals, your employer would want to know, what type of food are you eating? What price are you paying? And they should want to know. So for anyone to ask the government to pay for health care and then not start wanting to know a lot more about the type of care, the quality of care, the price of care is irrational. So I would just stress that once the government pays, the government is going to want a lot more information and will control these private and personal decisions.
And not just the government, all of your neighbors will feel entitled to tell you what you ought to be doing because what you're doing costs them tax money. So it started out with smoking, now it's obesity, and God knows what is next online. But there will always be something that people can hector you for doing if you are not in perfect fitness. And it strikes me as a very corrosive and destructive way to run a society.
Did he glance at me when he said obesity? I think he did. Did you see a little out of the corner of the eye?